They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started. Welcome back, everybody, to Decoding Health podcast. I am Dr. Urban A. Kiernan, serial biotech entrepreneur, metabolic researcher, and host for the next hour. Just want each and every one of you guys to be the best that you can be. Before we start, make sure you guys like, share, and follow us now on Rumble. We are live. You guys have probably caught the whole drama getting booted from YouTube. We are starting all over again. If it isn't for viewers like you following us and supporting us, this show wouldn't be here. So today, in the spirit of decoding health and making you guys the best versions of yourself, we've got a incredible guest today. By training, she's a chiropractor, but she's actually specialized in the version of chiropractic neurology. And I've been fortunate enough to go and visit her practice in real space. Some extremely interesting science that after I was there, it's like, I have to have you on my show. I need you to talk about this because our neurological health, from what I'm seeing right now, is extremely compromised just from normal everyday life. So everybody, please welcome on the Decoding Health podcast, Dr. Janine Crifasi. Dr. Janine, welcome. Please go and just give a moment to introduce yourself to the audience. And how did you get into chiropractic and more specifically the neurological aspect of it?
Absolutely. And thank you for having me.
Oh, you're welcome.
I love getting this message out because it is critical. So, backing up the bus, as far as me, I got into chiropractic because, as my family would refer to me, I was an accident waiting for a place to happen. And I would end up at the hospital. I mean, my mom was there so much they knew her by her first name. And one day she turned around and she goes, "You're not supposed to know that." So, I was always interested because I was looking at x-rays, whether it was for myself or other family members. And you know, to see is to know, and I love to learn. And so I just kept looking more and more into the holistic aspect. My parents would give me medicines, didn't like them. Sodas, never liked them. So I always had a penchant for taking care of myself.
Sure.
And again, I played hard and I got hurt now and then. My sister, would sometimes, she got more of like the infections in life. As a little kid, she had the croup and, she had to have her tonsils out and things like that. So we were opposite, but it was very intriguing to me, the different methods. And my parents tried to keep things as natural as possible in the household.
Good.
And absolutely. But you only know what you know until you know more. So fast forward in time, I had worked for chiropractors and I was like, this looks like a path I want to take. So let me back up the bus. I went to massage therapy school first because I grew up with learning disabilities. We didn't really know it. It was just at the time when I was growing up, we didn't understand it as much.
Sure.
So I had to work harder. That was it. Janine, just study differently, work harder. So I had that. I later learned that I was a surviving twin. So again, there's a little neurodevelopmental
Yep.
change that happened with that. Fell off the changing table, the one and only time my dad changed a diaper until I made him and held on to my son.
Right.
So fell down the stairs, multiple concussions in my own personal lifetime. And in doing so, I learned that other people weren't like that. So I started to do my own little research. Had the opportunity to go to LifeWest Chiropractic College, which most of the instructors that were at my school were the ones that were teaching worldwide. And I was like, okay, if they're there, there's a reason.
Sure.
Lowest default on loans. So I was like, okay, those doctors are good doctors if they're paying off their loans. So I had the opportunity to go there. They had a really strong support system for people with learning disabilities, and they still do. So just as I was graduating, I lost a cousin to Lyme disease. She was one of the very first people to succumb. She was the third ever diagnosed. And I watched it decimate her nervous system. So I had been surrounded by all the things that didn't have answers at the time. I have since worked with patients with concussions. I have worked at the Lyman Pan Center in Massachusetts and worked with many patients with long COVID and all of the things that compromise the nervous system, which is what chiropractic is. Chiropractic is about taking care of the brain and the spinal cord. We use those bones as levers. But as a student, when I would go to other doctors' offices to learn, hey, what's your technique? Why do you do this? What's your success principles? Hey, wait a minute. I saw that same person 6 months ago when I was here, or last year when I was home for Christmas. What is it? And they would be like, well, yeah, I don't know. They're still paying. Well, that didn't work for me. I wasn't comfortable with that
Sure.
reasoning. And in doing so, what I did is I was like, okay, this is going back to the brain. So again, what's going on with the nervous system? And as I was in school, Dr. Ted Carrick, who is the founder of functional neurology, chiropractic functional neurology, his literature after all the research he had done was coming to fruition. And back when I first started school, your nervous system, what you had is what you had. While I was in school, it came around to no, there's other things we can do with this. There's neuroplasticity, meaning when there's a part of the nervous system that's not working right and there's an area that's not firing, sometimes if we can come in from other ways or a different direction instead of beating the dead horse, you might stimulate some of those nerves and allow the brain or the nerves to communicate in a more efficient way or a more effective way.
Sure.
So myself and two students, we went to the president of the college and we said, hey, Dr. Carrick has this functional neurology program for a diplomate status. And he goes, well, you're still in school. You can't do it. But we were given the opportunity and afforded that privilege to sit in on his classes. So from the get-go, it was always part of my practice to understand the most I possibly could in an approach to help the body to heal itself.
And I'm keeping up with the conversation. I appreciate you going and giving this backtrack and giving some of the basic explanation of the
Uh-huh.
science behind it, because most people, when you start talking about the central nervous system,
Mm.
to them it's like a black box.
Right.
And it's just like they got absolutely no clue. And I've recognized the very because I use chiropractic as a part of my wellness and maintenance of
Mhm.
my health, but I've recognized that aspect of the business model that you didn't appre have an appreciation for, rightfully so, because it is a business, you gotta make money, but it's they some people practice their art in alignment with the sick care aspect. The more times I can keep you coming back, the more money I make. And
Well,
again,
that's a business model. That's not a wellness care model.
correct,
So,
correct. And so now you're trying to get to the root cause of all of this. But any chiropractic office you walk into, they basically, in some way, shape, or form, kind of talk about what you're saying right now, in which, okay, there's a subluxation, it's basically impinging the flow of information, so we need to go and correct that. So from a central nervous system standpoint, that information starts to flow freely now. Now, you're talking about this in practice, though, you do something very, very different, because to be honest with you, when you and I sat down and met, I wouldn't even go and associate some of the stuff you do as chiropractic. It's just like this isn't like snap, crackle, pop, like what most people associate as chiropractic. So can you elaborate a little bit further on, first and foremost, like the thoughts and methodology on this, and then maybe even some of the specifics regarding, okay, this is what we're doing and the why we're doing that, and then how that benefits the particular patient, rather than let's just do a joint adjustment for a
mhm,
subluxation.
absolutely. So again, going back to the root is the brain controls everything. every action, every reaction, every function, every perception that you have is because of the brain's interpretation of data. So your brain is up here, and there's neurological connections within each of the lobes of the brain into the body. So comes back down, communicates with the cells, sends it back up. And, the old green book models would talk about like a safety pin cycle. So a safety pin, which is what held my diapers together, if it opened, sometimes you ran the risk of falling out.
Sure.
Okay. It could be opened and it doesn't. It could poke you a little bit or nothing may happen. But we want that closed circuit regardless. So, yes, if somebody has a change in alignment that's affecting the soft tissues, it's affecting the joints, it's affecting the motor portion and the sensory portion of a nerve, because every nerve has that, then we need to do something about it so we can adjust it back into place. However, for example, scoliosis, the sideways curvature, if you're looking at somebody, the scoliotic curve is predominantly controlled by your vestibulospinal tract, which goes from your brain down to the body. We get input from a bunch of different neurological pathways that allow us and tell us where we should be in space. The vestibulospinal tract has been thoroughly researched that people can have corrections in scoliotic curvatures without even doing chiropractic or traditional physical therapy, by simply making sure that the alignment of the nervous system with the data coming into that particular nerve bundle and track can realign itself with the right stimulation to allow the body to function in a less compromised state. So why go in and pound on a joint all the time, or gently and effectively put that joint back, if inherently there's 24/7 information going to that to say, okay, stay here for a minute and you're going to get pulled back out.
Okay.
If a tire goes a little flat, you've got to keep checking it to make sure it stays even. Otherwise, it's going to go flatter, right?
Sure.
So what's the cause of it? Is it a slow leak? Where's the problem? So going back to the model for functional neurology, the brain controls every aspect. Let's look at which pathways in the brain are being affected and why. So myself and some colleagues, including Dr. Trevor Berry, who's world renowned for functional neurology, created a program called the Brain Restore Solution. Okay. The Brain Restore program has been devised because right now, Urban, I know you know this, 1 out of 3 of us has a neurodegenerative condition in our country.
Sure.
In the next 25 years, it is expected to be half of our population. Okay. It's already gone up 117% since the 90s. That's not acceptable, because right now our economy is absorbing $6.7 million of impact because of people with neurodegenerative conditions. When we fast forward in a time where presumably you and I, well, all 3 of us would still be here, that's going to be $1.3 trillion, barring any other situation like, for example, COVID. Long COVID has had a huge impact. Does that affect people's posture? Sure. When you're feeling low energy and not carrying yourself
Sure.
properly, that plays a part. Your brain requires mobility, appropriate motion governed by gravity, which is why astronauts have got to assimilate back into gravitational force when they return. You have to have oxygen, appropriate oxygen going on in your systems, not through oxidative stress, always draining and lagging the system. And we need supplementation, appropriate nutrition / supplementation. And when I say supplementation, it doesn't mean somebody always has to take nutrients. It could be food. You got to make sure you have the right food.
Sure.
And doctor means teacher, not omnipotent one. It means teacher. And sometimes that requires dietary changes, but there's so much confusion right now, even with that. So understanding functional neurology and the brain gut connection allows us to be able to communicate this most effectively with people. So we work with patients by assessing them thoroughly. So when patients come to our offices, what we're looking at is what is their cognitive resilience by doing a blood spot test to assess the appropriate nutrient ratios that are specific for optimal brain health. We're testing bedside integration of the lobes of the brain and then communication with their person, with their their biomechanics, their proprioception, how their brainstem and the cranial nerves are allowing things to integrate properly. We have a balance tracking system, which again, objectifiable measures is what we look for in practice to make sure that we have things to go back to beyond subjective complaints, like you were alluding to earlier, is we have to have data. We work with data. Science is specific. Math doesn't lie. Science doesn't lie.
Right.
So we have hyperbaric oxygen that we use. We use the 1.3 atmosphere chamber for our patients, which is concentrated room air, kind of like being on an airplane. And that helps to support cells, that helps to drive nutrients and waste products into the plasma to help circulate it better, to help glycogen storage, again, allowing our bodies to clear itself. That helps with the neuroplasticity because we want to keep those nerves firing. We want to optimize our life, no matter how young or how old. With a child, getting children care that they need, that sets them up for life. But sometimes, as we've grown up, there's been lots of mixed messages. People didn't know. Let's face it, clinical neuroscience, fastest growing field in healthcare right now. Because we also know that they're predicting in the next 10 to 15 years that both cardiovascular disease and cancer combined are going to be less prominent than the growth rate of neurodegenerative conditions. We have to protect our brains. you know, Concussions, CTE, the study at Boston University. I had a patient and a friend who was very active in the early stages of that. That research has been very profound. And, the movie was a reflection of what the research has shown.
The movie with Will Smith.
Yes.
Yes.
Yes. So, concussions are a traumatic brain injury, which so is an infectious agent crossing that blood-brain barrier. We all know COVID is the most popular one. Long COVID is an oxidative stress that has just completely overwhelmed the cells. And, you and I were talking, before the podcast about glutathione helping the body to recycle some of these nutrients that the body gets compromised with or from. So when we are able to look at the body as a whole and help the nutritional aspect to help the energetic aspect, we also implement low-level laser. And I say this not as a plug, but we trust our cornea laser because white papers have been done going back to the research we talked about.
Sure.
22-ish of the 26 white papers were on this low-level laser, which showed that the phospholipid bilayer, which is the cell that you draw when you draw a picture of a cell, that can toughen up and heal. Just like on a water balloon, you can twist them sometimes, cells, we put them through it. Sometimes they get dimpled. Sometimes they leak a little bit. We want to be able to heal the cells, and the frequency of light and the colors of light help the body to respond. And the physicists and the researchers, thank God for them, because they do all that stuff. And it gives me the opportunity to just go, okay, we have a setting for this. We have a setting for that. That's going to allow also the cells, the gated channels that we have in the cells, to work more efficiently, to help patients to be able to overcome some of the obstacles that they're having that's affecting their quality of life, making them feel like they have brain fog or that they're losing their words. And, let's face it, we all have moments where we're losing words or we lose track of what we're saying or we don't remember something. But when it starts impacting the quality of your life,
Sure.
your quality of health is directly related to your quality of life. You and I know this. You cannot have one without the other. You can fake it and try to convince yourself, but physiology and neurology, they need support. And we're here to educate people to be able to do that, you and I both in our own ways. And I just want to give people an opportunity for a multimodal approach to what we can do to help them. There is not one therapy, there is not one thing that is for everybody. But we want to be able to give people hope for their health. And that's what's most important. You know, my integrity is my softest pillow at night. And if I can help somebody, I want to be able to do that. If I can't, I'm sort of like this networking maven. Somebody said to me the other day, I want to be able to point them in the right
Sure.
direction. And so I appreciate your having me on the podcast to be able to share what we know. So
And this is a very, very important, topic that has to be covered because as a researcher out there, I fully recognize the trajectory that we're going on, and there's this growing body of evidence to show that in the case of um, neurodegeneration, it's a metabolic issue. There's the longest time school of thought, everybody's talking about the tau, and beta amyloid plaque formation, but that's actually even some people are thinking that's actually a protective mechanism that the central nervous system is trying to do to protect it.
stopping it.
Yeah, they're creating a shield, so to speak, but it's being bombarded by metabolic dysfunction. And you said so much there when you were explaining this. There's so many tangents that we can go down, and I would love to go down and discuss each one, but this would turn into a Joe Rogan experience, and we don't. Most people don't have time
Yeah.
to be able to sit down and listen to that. But let's start at the base unit of all of this, and that's the individual cell. And
Mhm.
so you're putting together all of this stuff from, increasing oxygenation with a hyperbaric chamber.
Mhm.
You talked already about, nutrients and making sure that the base building material is there not only to heal like the cell membrane, but to get your mitochondria up and running because we're constantly being bombarded either intentionally or unintentionally
Absolutely.
with stuff that result in things like reactive oxygen species. And I've had Dr. Rob Lustig on the show, and he talks about reactive oxygen species out there. I'm trying to get Ben Bickman on the show to talk and have him talk about
Great.
fructose and how that results in reactive oxygen species as well. But, that's where we have to begin because we are an organism that through our brains, we experience life in a particular position of space and time. And I'm gonna get back into that aspect of it because that's something that is just grossly just glossed over as a part, especially with children.
Mhm.
And as adults, we get very, very frustrated with children, especially neurodivergent, but they're taking in sensory input very different
Mhm.
than what we are in that concept of where am I at what point in time and how is my body reacting to all of this stuff we cannot fully know and understand, but as an organism we are made up of trillions of cells that are all talking to each other. And I already mentioned like the oxygenation. You mentioned even like red light there. Oh, not
Oh,
red,
yeah.
well, red, everybody's on this red light therapy kick. And but, I can't comment regarding which wavelengths of your lasers, and a lot of people draw you in regarding, "Oh, we use laser technology." It's like, okay, that's a broad term, like,
Or
w
photobiomodulation.
right.
Okay. Our photobiomodulation is low level laser. And in our office, we're using predominantly 405 and 635. Those are
Can you explain what the wavelengths actually
the
mean?
different colors in the wavelengths. So, for example, the 635 is the red wavelength.
Yeah,
The 405 is the purple or the violet
right.
wavelength, which bodes itself better for addressing things that are more like viral loads, molds, things like that. So the red in and of itself, that's where most of the research is done. And there's some research on the green laser. We do have one single green laser in the office as well. But red alone or the absorption of red in that is able to penetrate. And our lasers are incapable of creating heat. I have absolutely no qualms whatsoever about waving it over the brain. Having it, we have standalones that have rotating diodes. So I can have a patient laying there. I could be addressing the prefrontal cortex. I could be getting the parietal lobe, helping for sensory motor integration, and I can be hitting the opposing cerebellum. We also can use it for musculoskeletal, but it doesn't have enough what's called joules or heat component capacity to injure anybody. And
Gotcha.
that gives me peace of mind. We
Right.
can use it on, on youngsters. We can use it on the elderly, very few contraindications, but we're mindful of what are there that we wouldn't use it on. So yes, we're doing everything we can to help the cells, because when the cells are functioning best, then they're going to communicate with other cells better
Right.
and to their optimal level. And then when we go beyond that, then when the cells, because again, we're trying to always stimulating the gut for healing and the brain for healing, because there is a direct connection through the zonulin bridges. So within 30 to 60 minutes of an insult of one to the other, you're going to have an impact. So we want to do what we can as safely as we can and as expeditiously as we can, so that we don't always have a smoldering fire between the gut and the brain.
Right.
Additionally, you touched on this, is activities. We need to have the activities. Think about it with an injury. You don't exercise when you have an injury the way that you would. Imagine this on a systemic level with your cells being perpetually injured. So as we start to help the body to heal, then the rest of the body is going to follow suit. And when you have very strategic, very methodical ways to help somebody live comfortably, to live optimally, to not just get up and exist through the day, to have your thoughts be congruent with your choice of your lifestyle, of your habits, of your career, and then to set you up for the best opportunity for all of the hard work you've done to have a healthy retirement, because your brain is working great. To me, the earlier you can start somebody to set them up for life, because every parent does that. You give your best advice. Give your best advice to every cell in your body in every phase of your lifetime. So if you can get somebody to understand, and I know you and I both spend our days doing this, is talking with people to educate them.
Sure.
And, in our programs, once we know we've got good substrates, on a metabolic level, then we can start going into some of the physical activities. But even on a passive way, we can even do neurofeedback after we're doing our brain maps, our QEEG brain maps, to identify. I had a lady in the other day, and we brain mapped her, and she thought she was going to be, the epitome of health. And then we started talking about some of the low level undercurrent symptoms she has. And it was a big, red flag for her. And I said to her, she's like, well, she called me back the next day. I think I need to start. I was like, no, I think what you need to do is follow what we talked about. As a matter of fact, we talked about glutathione, like you and I were talking about. I was like, you need to get on some glutathione. You need to go on a couple of other things. Let's get you stabilized, and then start building you up. Then we can start talking about different physical activities. We already talked a little bit about some dietary changes. Dementia is known as type 3 diabetes.
Sure.
So sugar is sugar, folks. It doesn't matter if you're eating a candy bar, if you're having carbohydrates, fruits. People are like, oh, well, I don't need vegetables. I'm just going to have more fruits. Well, fruits are sugars. I was with a friend the other day, and she was all stressed out. She's like, I just came across my cardiac panel, and, she had just had brought home what do you call it? She said she bought a carrot cake because it was, she was like, I deserve that. And then she had a handful of fruit, and then she goes, and what are you doing? I'm snacking on a rice cake. It's like sugar, 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 sugar.
Sure.
But she didn't really, in her mind, oh yeah, only the carrot cake. That's not true. So, again, that's part of the education process.
Are you sick and tired of feeling sick and tired, want to reclaim your metabolic health, but you really don't have the time or the ability to eat as clean as you would like or spend hours in the gym? Well, here's a new biohack that I've implemented as a part of my life. Just by including these two products as a part of my daily routine, I am able to achieve my health and fitness goals by doing nothing. Protocol is all natural, it's simple, comes with a money-back guarantee. If this is something that is of interest to you,
Click on the link below and let's learn how to feel great together. And so my mind's going down all of these different, like, rabbit holes. And I think one thing that we also have to kind of bring into, because you had mentioned how if you do all of these neurological improvements, it improves, like, your job, your career, and everything. I have to also throw in their relationships as well.
Oh, 100%. You're right. You're right.
And it's we are social creatures, and let's take it back to the organism at a cellular level. We are social creatures. We are not single-celled organisms, and all of them, everybody needs to be happy as a part of this. If you it's not about survival, because your body is pretty tolerant in terms of staying
Mhm.
alive. The
It
question
is.
is are you going to thrive? And
Right.
and that's the point of this show. This is what I'm all about, and I'm 52 years old, and I'm living the best life possible
Mhm.
because I take all of this stuff seriously. And, whether or not somebody walks in through your front door or not, or maybe they like to just go to, like, Lifetime Fitness or something, like, and they just go to the gym. You're moving, you're probably putting better food choices into your mouth. Probably nobody's doing it, like, optimally, because there's so much, you speak to the you're eating a salad and the carnivore is, like, telling you, it's just, "You're insane," there's oxalate. So, there it depends upon which kind of tribe you go into, but even, like, you with even with the lasers, people forget, like, heat is light. It's infrared radiation. You go into the sauna, everybody talks about, "I'm gonna sweat this out." Well, no, you are actually getting penetrating wavelengths of light that you can't see. I'm kinda gonna sound a little bit about like, Dave Asprey, now as a part of this, like, but there is truth behind that, and, like, we live in Arizona here. I've stopped wearing sunglasses because I want more UVA coming in through my eyeballs to help stimulate brain-derived neurotrophic factor to help all of this stuff going forward. And so, we have this huge uphill battle, and you've already kind of talked about this, that people are confused because there's a ton of social media influencers out there, myself included, on this. But there's so much stuff being thrown out there regarding buy this product. And I'm not going to go and poo-poo on anybody regarding a the benefit of a particular molecule, but by taking a molecule as a supplement, so to speak, doesn't necessarily translate into any type of benefit. The bioavailability is a real thing.
Exactly what I was going to say.
And so, like, in the case of me, to support my thyroid, it was recommended you increase your selenium. Everybody hears that. So you can go and, like, go to Sprouts and buy selenium pills. I tried doing that. It didn't work for me because my body wasn't absorbing that selenium. Turns out, eat 3 Brazil nuts a day. Okay, that's still selenium. It's still the selenium molecule, but it's in a format in which my body is like, "Yes, I'm happy. I will absorb you." We already talked about glutathione. Well, that's a very twitchy molecule because there are people who will sell you oral glutathione, which I'm not convinced your body actually absorbs that. Your body produces glutathione. So how do you turn around and get your body to produce more glutathione? Or what are the appropriate precursors to nutrient yourself? So as a part of your practice, because again, we want this kumbaya within the organism. Let's start. Say somebody's living in Cleveland, Ohio. Like, I don't know if you have a clinic in Cleveland, Ohio, where they can turn around and walk into and get this, or they're going to have to create a Frankenstein type approach of getting help. I have to go here, go there, and finances are a very real thing. But just like in that patient case that you said, "Hey, Dr. Janine, I need to sign up." Okay, let's. No, you don't. Okay, and I admire the simple fact that you could have made a lot of money off of this
It's
individual.
not about that. It's not about that. If I wanna make a lot of money, I would have gone into a different career, you know? It's
Oh, no,
this is about helping people, and helping to clarify the myths, as I understand them,
right.
So
And so as a part of that, your recommendation is let's go and get these things up to speed. Let's see how you feel, and then we'll tailor our approach at that point in time. But it's not like, hey, go and watch Andrew Huberman and see what he has to say on this. You had direct recommendations on this. And I'm sure that recommendation list, depending upon what a person's suffering from, is deep. But let's kind of talk.
it's deep, but it's limited. And by the way, there is a Brain Restore Center in Ohio. I just don't know that it's in Cleveland. Just for the record, Dr. Jim.
Gotcha, gotcha.
So,
Yeah,
but
yeah,
but back to your
yeah, so
quick.
the question is like there's things that people can start implementing in their home
Right.
right now, but if it's just like, "Oh, just go and, here's our discount code for, like, some sort of thorn." Yeah, and again, I'm not taking a shot at
Right.
thorn, they've got some good supplements out there, but just going and buying a bottle of stuff and then popping that pill every morning
You
isn't
know, the
necessarily gonna fix anything.
No, no, it's not because again, if the gut or the brain are inflamed, you have everybody's heard of leaky gut now. Like, when I was going through school in the 90s, nobody even like hardly knew what it was. Even I
Sure,
had a raised eyebrow. But when you start to understand it, it's like anything else. You've got I refer to this in my office. You've got the band of brothers. You have soldiers and military and police that stand shoulder to shoulder. You're not getting past them. But then you got the boy band, right? Where everything gets through. That's leaky gut, okay, or
gotcha.
leaky brain. So things can get through there. So there's a perpetual inflammation. Sometimes that's even from a food sensitivity. I had a child years ago, great kid, great family. Moms loved him 1-to-1 earlier in the day. We started putting two and two together. We did a food sensitivity test. He had a multi generation organic apple farm. He ate those apples every single day for snack. Family friend had a peanut farm. Tested green on this, good. Tested yellow on this, which meant might be a little iffy on the peanuts, which many kids are. We tested them together. It was like fire for him. It made him appear like he was ADHD, confrontational, because his brain became so inflamed. So, one thing I would suggest if people are feeling not quite themselves and they wanted to do something, I would start with monitoring your diet, keeping a food log, watching your own reactions to things. Vitamin D is probably, if there is one thing I would tell people, everybody's on vitamin D kick, and vitamin D is warranted. But even here in Arizona, some people still need supplementation. Vitamin D drives so much of our endocrine system.
Right.
I suggest sublingual, okay, and good quality.
And with the vitamin D, also get some sunlight too.
Oh,
Yeah,
absolutely, absolutely. So the people in Cleveland, they probably need to get a little bit more. I grew up latitude 22. So, my whole life, we went through our seasons. So for me, most of my life and most of the people I know, we needed that extra supplementation. But even here, being in Arizona where there is sun, 325 days out of the year or something,
at least.
at least, or at least part of that day, my body still needs that,
Sure.
still needs the vitamin D. Eating good quality foods. A lot of people don't even know that when you buy organic, if the reason we say buy local isn't just, to support local economy, but when you buy organic from Bakersfield and you live in Texas, it gets sprayed leaving leaving California. It gets sprayed leaving Nevada or entering, I forget, Arizona, Texas. It's not organic anymore.
Well, and it's by the legal definition of what the FDA allows. It's like organic is actually locked into the growing process.
Right.
Once it's harvested, that's a totally different
Mm.
ball game, and, like, again, that's a show in
But
itself.
right, but these are things that people, to answer your question, these are things that people can do at home, is start looking into their own health, cutting back on the sugars like we talked about, and the carbohydrates, that's another big thing. Gluten and dairy, and not to get political about it, but gluten and all of the effects of the glycophosphates and all of that, or glyophosphates, those all have an impact on the cells. And I think about when we were kids and the ice cream man would come by and you can get that like bubble stuff that you would blow through. It was some like super bubble thing. And you blow it up and it was this toxic ball of something that had sparkles on it. That's what gluten does in your belly. Okay. It's, and I say gluten as in American gluten, okay?
Right.
Because 27 other countries have never had any pesticides on their soil. And I know people that were diagnosed as celiac patients that have gone to, for example, Italy
Yep.
and eaten the pasta there. So gluten as we know it here in America, stay away from it. We know we know that it has an impact on the cells. We know that it's linked to brain fog. Research has shown that predominantly gluten and dairy, because of their molecular mimicry, have the potential to create ataxia, imbalance in people's gait. It can create an autoimmune reaction
Right.
subclinically. And it doesn't mean you're laid out and you've got a rash or anything like that, but lots of little bits of it adding up
Yeah.
can cause somebody to almost look like they have cerebral palsy. I've seen it. A friend of mine, Dr. Brandon Brock, did a lot of research from soldiers coming back from Afghanistan, and there was one that he uses in many of his lectures. And this person can't even walk down the hallway, mumbling when he spoke, only to find out because he was overseas, and they try to get our troops whatever they can, and what's fast and furious is pastas and breads and things like that. And it just finally got to a point, and this man who spoke 7 languages and was a high tier military officer was failing. And it took a long time. And even now people are like, oh, well, I'm going to try not to take it. You either don't have gluten and don't have dairy, or you do, because a little bit is still having inflammatory process, and so excitotoxins like corn, corn is less of a vegetable and more of a pesticide when we eat it.
Right.
So even if it is organic, so taking things out of our diet is sometimes even more beneficial than what we can put into it. So those would be the bare minimum basics that I tell people.
And that food elimination process is extremely interesting, and it's just like if somebody goes into like rehab, it takes time. Gluten purging takes 6 weeks. Most people don't.
Months, 3 to 6
3 to 6
months.
months. Okay, we were
Yeah.
told 6 weeks,
Yeah.
and so you kinda touched on the food sensitivities. Now, we're not talking about, like, a peanut allergy where you go into anaphylaxis. Can you touch on that? Because there are some really good food allergy testing kits that you can even order off of, like, Amazon that are recommended, and it is extremely enlightening, especially, parents out there. If you've got a child suffering from, like, ADHD, and it's just like, what's going on? Like, the obvious red food dye.
Mhm.
That's one of the obvious culprits. It's like, please cut that out. Like, eliminate that wholly from your child's diet, even if they aren't showing ADHD symptoms.
Right.
Get rid of that. But like from a food sensitivity, testing, what are you guys looking for? Because there's a lot of interpretation that goes into food sensitivity testing. And I got to be like very careful here, but there are foods that used to be viewed as very anti-inflammatory, um, such as eggs. And now people are coming back with extreme food sensitivities to eggs, and my hypothesis is that's because of the childhood jabs, because there are a lot of those are actually grown in eggs, and people don't realize that, and there's cross-contamination, and when they do those jabs, the body goes crazy, and
Which it's supposed to.
it's
When
supposed to.
you're getting injected with something, we want our body to react to it.
Right,
I mean, God forbid it didn't happen. We would have died as a species thousands of years ago. So we do want our bodies to respond, but we want it to respond in a favorable, appropriate response,
right,
not in an extreme, an extreme reaction.
right,
And sometimes, again, like I said earlier, sometimes it's visible, sometimes it's expressed, like it did with that one particular patient, that young boy that I talked about.
right,
So there's a lot of different ways to approach it. But like I said earlier, diagnostic criteria doesn't lie. Data doesn't lie. Well, data shouldn't lie. So you want to make sure you have a reputable company. But when you look at what's happening, that can help you to change it. Myself personally, again, I told you I was an accident waiting for a place to happen. I had brain trauma. I could not eat eggs for 8 to 10 years. And, one of my aunts suggested something to my mom. My mom did this, like, hocus pocus test, which I later learned was a food sensitivity test. Guess what was on it? Eggs. Now, you can make the argument, well, there's a lot of choline in eggs and you should be having, yes, there is, but you have to weigh your options.
Right,
So, when somebody says, well, I'm not giving up my whatever, my lectins.
right,
Okay, don't. But if that's something that you're sensitive to, allow your body to heal. Like, allow your body to heal, regroup, then start reintroducing things. But let's face it, in our society, people are so fast paced. We get what we get when we want it. We just sort of sometimes have this sort of attitude that we're going to get past it.
right.
At least there's a shift and people realize, gee, getting that other jab or that medication that the doctor said is going to help my diabetes, it doesn't, it helps to a certain degree. You can help yourself more by making lifestyle changes.
I think you're kinda, like, hitting the nail on the head because you mentioned the diabetes term, and Western medicine is purely gonna go and view diabetes from a sugar management perspective, but diabetes is more than just sugar. It's be and I am empathetic to the Western medicine system. They are overburdened, they've got a lot of crap that they're dealing with, and they're doing, in all honesty, the best they can with the tools that they have. Now, you're in a very, very unique position because you're outside of the conventional medicine system. And what I say by that is cash pay.
Because I want to spend time with my patients.
Right, right,
I was talking to a physician a week and a half ago. I actually spoke at the BioLife longevity seminar, and they are having to see 60 to 70 patients a day.
right,
I mean, it's not quality, it's in and out, and it's frustrating,
right.
and they're getting out of it. I mean, there's a lot of concierge medical doctors. I was
100%.
running I was running 4 neurology clinics in New England when I came here to work in Arizona with Dr. Berry. And in doing so, more and more doctors that were coming out of Mass General and Tufts, they couldn't do it. Their integrity couldn't allow them to not see the patient. So yes, I'm in a unique position, but it's hurtful to me sometimes because some patients can't afford.
Sure,
But on the flip side, there were some patients who couldn't afford insurance anyway. So I had to make that decision of, I want to be able to help as many people as I can
right,
and do what I can. And if I become uber wealthy, then, hopefully I can pivot. But we've tried to make this as affordable as we possibly can for patients. And in many ways, in many cities, it's actually less expensive than going for massages.
right.
But most people don't buy 36, in a group or whatever their treatment plan may be. So
Well, and the financial aspect of healthcare is extreme. It's extremely morass because what I originally started talking about was, like, the payor system, and, like, ladies and gentlemen, like, the payor system is becoming very, very political, and there is no free lunch. You get what you pay for. And we have to go and fully understand, from a 360 comprehensive perspective, what is it that you're going to wind up getting
mhm.
as a part of it. And yes, some of this stuff is very expensive, but my question back to people is compared to what? If you're looking at this cost right now versus long-term disability care later. Have you looked at what that's projected to cost you and your family, if you can even afford that then? Maybe this is something that you should start looking at now. And, like, one of the things I always joke with people about is like, well, that particular thing that you're looking at is it's too expensive, but you're willing to pay for, like, one of the GLP-1 shots.
Mhm. Right.
You really don't need that, like, correct your body, you don't need that. All of these different medications, you're taking all of these supplements, like we were talking about gut microbiome. One of the big things that people are are supplementing like crazy because there are some big name people that are promoting is urolithin A. You don't need to supplement urolithin A, your gut microbiome makes it for you. Get your gut microbiome
If
already
it's healthy, and we wanna make it appropriately.
make it appropriately healthy, but from what we understand from the science, if you've got that appropriate gut microbiome,
Mhm.
save yourself the $150 a month and go and put it towards something in terms of getting you there.
Well,
But
and it's too urban, it's not even just about the patient. It's the burden of some of this on the family.
oh, 100%.
It's not only, okay, yeah, I'm not doing this. We'll talk about neurodegeneration. Neurodegeneration has an impact on the family, the extended family, the other resources. Diabetes. You have all the complications of diabetes. You have complications of just people, the social impact. You talked about being social. People being withdrawn also has an impact emotionally and
Sure.
physically on family. So, and financially even. And
Yeah,
like,
yeah,
you talked about you want quality relationships. And so it is looking at all of that 100%.
yeah. And you can't put a dollar figure on that. Like, I'm a granddad now, and it's like,
Congratulations.
thank you very much. And am I gonna be remembered by my grandchildren as grandpa was really cool, or I didn't wanna be around him because he would have the outbursts, which comes with neurodegeneration.
Well, you want
Personal
to remember your grandchildren while you're here too.
oh,
So
100%.
yeah, so it works both ways. Yeah.
And so but your children and then ultimately your grandchildren, to me, that becomes your legacy, how they remember you. And you set those seeds, those foundations right now, and all of this coming back to the whole concept of metabolic health, and people have to pick and choose what they're gonna do. And like, there's people who have celiacs, but they were raised in Italian household. "I'm not giving up my pasta." Okay, I can concede that because it's a cultural aspect, but somebody explain to me, where does the triple latte macchi like, I can't even say it correctly because
I
I
don't
don't
even think they
order it,
make
so
that in
yeah,
Italy.
but, how does Starbucks fit into your family culture? Because that's, like, literally, like, $8 right there that you're doing every single day, and it's not helping you
Well,
one bit.
economists refer to that as the latte factor in your budgets.
Oh, there's actually a term
There,
for
it's
that?
called the latte factor because people will budget, whatever. They'll go every day or once or twice a day to Starbucks. And like you said, you're talking $8 times 30, roughly 30 days a month, blah, blah, blah. It's a factor. It is a budgetary concern.
Yeah, and that's a couple of treatments, potentially, to make yourself have again, not just survive, but thrive as well in all of the goodness that winds up, coming back, coming along for that ride. And, I'm trying to be mindful of time here on everything, but like, the Pandora's box is open. So the last thing I really wanted to kind of touch on is because you mentioned it a few times is the gut microbiome. And this is a huge new area of science. And there's different ways of turning around, you know, you are what you eat, but more importantly, your gut microbiome is what you eat, and that will have what we're learning now is profound influence
Mhm,
on how you are able to perceive yourself in space and time,
mhm.
because that is your reality.
I want to change something that you said. It's not new. What it is, it's being better understood and better studied.
Correct,
So
correct,
yeah,
correct.
this is nothing new.
Yeah, no, and I'm saying new from, like, a medicine
Mhm,
research. It's finally gaining the interest that it deserves, but there's a lot of ways of turning around this, it's appropriate food choices, food elimination, that's a huge
mhm.
aspect to it.
You can
Um
even do that on your own without a test and see, go, "Oh, you know what? I whenever I have such and such, that really bloats me." or I'm gaseous, or whatever the case may be. You don't have to necessarily spend money on a test. You can start on your own with an elimination diet as well.
Oh, the whole
Yeah.
30 is probably
Yeah.
one of the
Oh,
biggest ones out
absolutely.
there, and you go and you do it, and all you do is you go to a basic diet for 30 days, and it's not so much how you feel after that 30 days, it's when you reintroduce something
Yeah, it's
back
clear.
into it, and it becomes crystal clear after that 30 days, like, "Wow, my body hates that."
Mhm.
Okay, don't eat it. You know, it or eat it.
Yeah.
I'm
Eat
very
it, but just know there's a consequence.
100%.
Don't
And
act surprised.
so but back from the gut microbiome standpoint, because this is one of those areas that is very influenced by product out there. You got prebiotics, you got probiotics out there. I am not a big probiotic person because I refer to it as like a cattle farm. You've got a farm that will support 10,000 head of cattle,
Mhm.
but it keeps on dying to like 5,000. So I could turn around and just keep on adding 5,000 heads of cattle and accrue that cost. Or maybe I should figure out why are the cattle dying and take care of that
Right.
issue. So kind of leaving our audience members with this whole new concept of gut microbiome, where would you suggest that they begin that process? Or is it simply, let's just start off with food?
Oh, always start out with food. Because again, when you are what you eat, like you said, know how your body's responding to it. And like the whole 30, yes, it seems tough, but once you do it, it's well worth it. And that's not the
100%.
only diet to do it. Like I said, start taking notes. Start simple. And it depends on how serious you want to be about it. You can go deep, deep, wide and deep on this. But start with the basics. Make a change. Take that first step, make a change. Monitor what you're taking into your body. Let us not overlook water. A lot of people eat their water content.
Right.
Okay. And what I mean by that is all the products in a box have water in them that help make them. People are substituting the dehydration for putting food in their mouth. So that's another aspect of it. Probiotics and prebiotics, there is a place for them short term. I actually just had a discussion with this with a patient of mine because everybody's got Dr. Google. Okay. There is no Dr. Google. I have not ever met him or her. Okay. I get the research part, but we all didn't go to school for as long as we did and have the affiliations to make your lives easier.
Sure.
So, even fasting, the research is now showing intermittent fasting, people are missing breakfast, 40% increase in dementia. So you've got to find what works for you and where your body is going to be able to reprocess. But again, prebiotics, probiotics, I agree with you. If you can get the gut in order, then you don't need them as a standard supplement. Some people, when they have challenges in what they're able to withdraw from their diet, or they're not as detailed in the ways that they can be to modulate their diet on their own, then I think there's a short-term place for them to help the body and then take it from there and run with it.
Gotcha.
That's the way I feel. That's my professional opinion.
Gotcha. And if somebody were to become obviously your client, again, how many locations do you service?
Well, I'm here in Arizona. There are 26 other brain restore centers across the country currently, or
Gotcha.
25 other right now. And these are doctors that have come on board because they've seen the impact of brain health in their own practices. And they range from other chiropractors to there's a neurosurgeon who's joined on, acupuncturists. It's people that want to make a difference with patients' brain health. So.
Gotcha. And so if somebody wanted to learn more about this,
Mhm,
learn more about you,
mhm.
where exactly can they turn around and find you?
Well, they can find me they can look up Brain Restore Center, Dr. Janine, or J9. That's how I grew up. That was how I got picked on. And I'm at the Arizona Chiropractic Neurology Center, which is also the foundational Brain Restore Center here in Chandler, Arizona. And our phone number is 480-756-2600. Dr. Janine YouTube will be coming out soon. So I have
Perfect.
a variety of podcasts to help piece together the different aspects of what we have. And on our website, azchironeuro.com.
Yeah,
would be
because
another way to find us.
just in the course of this last hour, a tremendous amount of information that was shared that, I could sit down with you and we could just go and do a deep dive into each and
And we
every
do
one of
even when we talk on the phone, so we're
no,
like,
no,
"Hey,
really.
hey, did you see that article?"
Yeah, no, no, no. Well, we have some very deep,
Yeah,
deep conversations and text messages too. I'll
yeah.
just kind of throw that out there. But no, regardless, really appreciate you being on the Decoding Health, sharing it with our audience members. I hope you guys got something out of it. Again, make sure you guys check us out, either Spotify or Rumble. We're on there. Drop your questions.
Absolutely.
Let us know what you think about this. Tell a friend. This is let's turn around and I want to access you and you access your network
Mhm.
for sharing information just simply because you won't get it walking into your GP's office. Like as we already explained the
Not
system,
typically, no.
they're not educated on it. And they really don't have time. I'm gonna make the assumption they want to help you with that.
Mhm.
It may not necessarily be the case with everybody, but they just don't have the ability to sit down and do this deep dive like what we did here and like what you turn around and offer to all your patients. And again, being in your clinic, some of the stuff you do, I'm like, that is like actually really cool. Like from the eye
Well, yeah,
monitoring to
yeah.
the reaction timing stuff and
Yeah,
everything.
the sensory motor integration activities, it's therapeutic modalities for brain-based concerns is what we do.
Yeah.
And, very specific and such. And thank you all very much for your time. Urban, of course, thank you for this opportunity. As a doctor, I want to teach people. So thank you.
Awesome. Thank you very much for caring and being out there. And again, you guys got the CTA. Go and share this. Tell everybody about it because this information needs to be known. And we will catch each and every one of you again on the other side.